Good health is of major economic importance for every country around the world. Only a healthy population can truly achieve economic and social growth. That point alone tells us how important innovation is, especially in healthcare. It also shows us how much more we can still achieve if we lean into partnerships and help each other stay healthier. With all the great minds that have gathered here today, it is clear to see that we have the capability and the technology to solve healthcare problems very fast at an unprecedented scale. But this is an ongoing process. At AWS, our healthcare and life sciences mission is to enable access and delivery of person-centered healthcare, to drive improved outcomes at a lower cost by accelerating the digitizing and the utilization of healthcare and life sciences data. We continuously achieve this by providing the security, compliance, and data privacy that healthcare and life science organizations can trust. Accelerating innovation, unlocking the value of data, and powering the transition to personalized healthcare delivery. With that being said, I'm honored to call on stage Africa's first and leading hospital-at-home service that provides hospital-level care in the comfort of your own home, using the power of AWS technology. Ladies and gentlemen, put your hands together for Vuyani Mhlomi and Yours Pillage of Quro Medical.
Good afternoon, everyone. Thank you so much for joining us today. My name is Vuyani Mhlomi, and this is my colleague, Yours Pillage. I am the co-founder and CEO of Quro Medical, and I'll introduce you to what we do at Quro Medical, and I will then subsequently hand over to the man that builds all the magic. Healthcare is changing. Doesn't matter where it is you go. A lot of people, including in South Africa, may think that healthcare is failing. We've seen that we've got doctors who are unemployed, hospitals are overburdened, you've got rising healthcare costs, you've got patients who are contracting nosocomial infections in hospitals, and this is a challenge that is not unique to South Africa. This is a challenge that is being faced by the world over. And so at Quro Medical, instead of looking at healthcare as failing, we see an opportunity for it to change. And the reason why healthcare needs to change is because we are stuck in this terrible, vicious cycle. On one hand, we've got a hospice-centric system, which basically means that you cough, you land up in a hospital instead of going to a primary healthcare facility. And what we then have is that more and more patients are being admitted into hospital. Once you're in hospital, you've got duplication of services where you're being seen by 5 different medical doctors. Your bloods are being taken by Ampath, Pathcare, and Lancet. You've got different types of specialists that are involved in care. Once you leave the hospitals, there's often a significant gap in the continuity of care. For example, your GP would have referred you to a hospital for pneumonia. You leave that hospital with a hip replacement. There's poor medicine reconciliation, so patients are taking a number of the same drugs. The absence of follow-up of these patients by their doctors means that opportunities for interventions are often missed. The same thing is true that if we're not monitoring patients post-discharge, we often miss some of the opportunities to intervene. What then happens is that because of all those gaps in care, these patients are back in hospital, which is what drives the high rate of readmissions. And so South Africa, much like the rest of the world, is trapped in this vicious cycle where you have declining quality of care, but also an increase in the cost of care. Let me drive this point a bit home by showing some statistics. Healthcare, as everyone knows in this room, knows that it is becoming increasingly unaffordable. The average cost of a stay in a South African private hospital is sitting at about 42,000 rands. That's a 3.5 stay. I mean, this is a very, very expensive hotel. The second part that I want to highlight is that we're seeing a growing number of conditions that actually require hospitalization. whether this is a result of non-communicable diseases such as diabetes and high blood pressure, or patients downgrading their plans to hospital plans, and therefore the only way they can get care is by being admitted into hospital. But the reality is that hospitals are not just expensive. They are also associated with unintended clinical consequences. 20% of the elderly suffer from an acute confusional state just by being in a foreign environment, which is the hospital. 1 in 3 patients that walk into hospitals will lose a functional status that they will never regain. So you just become weaker by being in this environment. And then lastly, 10% of patients will have an acquired hospital condition. Or a fall. And these are some of the things that we're seeing in that hospital. And this is before we've spoken about hospitals being a hotspot for hospital-acquired infections, including things like COVID-19. But more importantly, I want you to drive the point around costs. Focus on that graph up there. This is potentially the most normal year we've had. This was in 2019, pre-COVID. What you're seeing here is how we are spending money in the billions in healthcare. And the biggest portion of the pie is what we spend in hospitalization. That's about 40% of all costs. That's really the bed and breakfast. That is unsustainable. And so at Quro Medical, what we've done is that we've then looked at what is currently offered in traditional hospitals. And so if you go and be admitted in a hospital today, you'll have your doctor providing oversight, you'll have monitoring potentially by the bedside, or you'll have a nurse coming through every 4 to 8 hours. You'll have a nurse who's available to look after you if something goes wrong. You have in-person consultations, medications are being administered, oxygens, blood pathology, and other services that you do have. So what we've done at Quro Medical is to take all these essential elements of in-hospital care and we bring them to the home. And so we've built a one-of-a-kind virtual hospital. And I will speak about this later because you're probably wondering, how on earth are you managing to build hospitals across South Africa without having brick and mortar facilities? And so within our model, your doctor will provide virtual oversight. You have real-time, minute-by-minute monitoring. All this data is transmitted to a 24-hour command center. We do both in-person as well as virtual visits. All the medications, doesn't matter how they get administered in the traditional hospitals, we're able to do so at home. We've partnered with all the major laboratory entities. We provide skilled nursing, physiotherapy, and other allied healthcare services. And what brings all of this together is a network of emergency medical services providers so that when our patients show signs of clinical deterioration, we are then able to escalate their care as and when necessary. Of course, in order for us to be able to do this, we leverage technology. And so we've brought state-of-the-art wearable technologies that is medical grade. And so what we do is that we bring hospital-grade monitoring into the home. We are able to monitor all the traditional vital signs that are normally tracked in the in-hospital environment. Heart rate, respiratory rate, core body temperature. We track blood pressures, glucose. We know when our patients are sitting up, sitting down, lying flat. We've got fall detection capabilities. So if a patient falls, we're able to pick that up very quickly. We've got an ECG, so we can pick up if our patients are going to have got an impending heart attack, right? And I'll speak about this soon. And what is great about our platform and our solution is that we leverage technology that is both SAPRA approved, FDA approved, and CE marked. We are able to look after a whole host of clinical conditions that are normally looked after in a traditional brick and mortar setting. But we also know that this is not a service that is for everyone. So if a patient is critically ill and they need to be in ICU, we don't want to see them. They should be in hospital. But if they are good enough to be in the general ward, we are able to look after these patients in those general wards. The service at the moment is only provided to patients who are 18 years and above and who reside in areas in which we have presence. And so at the moment, we're in 5 of the 9 provinces. And so we look after patients who reside in those areas. And so this is not for the preserve of those who live in Houghton or Sandton or Somerset West if you're in Cape Town. We look after patients in Soweto, in Khayelitsha, in Cape Town. And it's really making sure that we are able to expand access to healthcare for everyone. And so very simply, when you're unwell, you go to your GP, they admit you into the hospital, and you get discharged. Patients are able to access our services at any of those points. You go to your GP picks up that you need to be admitted to hospital. Instead of going to a general ward, you then come to us, and we will look after you. Alternatively, if you have a condition that requires hospitalization, such as surgery, well, you can go for your surgery. We then facilitate earlier discharge for those patients. And then lastly, for the patients who are sitting on the other side, which is a post-discharge solution, this is for patients who've had a rough course in hospital and they are at high risk of being readmitted. And so we then take them and we look after them in the at-home environment. And so Quro Medical has really engaged in what we consider to be a very kind of bold and brave undertaking. We're not sitting on this side where you've got patients with colds and flus. That's what the traditional telemedicine does. Nor are we sitting on the other side where you've got patients who are very, very sick in ICU and who need to be in a high care. We're sitting somewhere in the middle. This is for patients who actually require general ward and subacute care. And so for those of you who are familiar with the different hospital groups in South Africa, we look after patients who would normally be admitted into those general wards by those hospital groups. The difference here is that we do it at home. And so Joost, with our colleagues, inspired by some of us who are clinical colleagues, have really built what is a really, really intelligent clinical solution. And this we call Quro Medical Insight for two reasons. One, we generate insights that are important to the care of these patients, but also our patients are always in sight. Doctors can access this platform from anywhere. They can download it on Google stores or in app stores, and they can access it as a web application. We are able to look after tens of thousands of patients at any given time. It is robust and it is scalable, and most importantly, it is disease, wearable, and cloud agnostic. We like to design things that are simple, intuitive, and elegant to use. More importantly, our platform is a single source of truth. We've integrated with laboratory entities, with medical schemes. You've got clinical notes coming from doctors. We've got vital sign information that is also coming through from patients, amongst others. And so really, it's become a single source of truth to enable the doctors themselves to be able to make the clinical decisions. Once you're on our platform, doctors can navigate through many different parts, but I want to highlight this particular part, and this we call the healthcare dashboard. Here we are able to see in real time how our patients are doing. The line on top, which is written AWS, is an early warning sign or an early warning score. It allows us to pick up which patients are going to run into trouble and mobilize the necessary interventions and intervene before those patients deteriorate severely at home. Let me share with you a very important statistic. Studies have shown that the number in yellow, that is called the respiratory rate. It goes down at least 6 hours before cardiac arrest. But it is a number that is poorly recorded in traditional brick-and-mortar settings. People rely on oxygen saturations, and some of them rely on blood pressure, which is often the very last parameter to track. So at Quro, we've been able to develop, leveraging the National Early Warning Score, a mechanism of identifying these patients and building in a buffer for intervention for some of these patients. Beyond that, and I know that this is not necessarily projecting pretty well, we are able to look at how a patient deviates from their own baseline. So the data itself is personalized rather than having interventions on sort of arbitrary thresholds of normality. Doctors are busy. So we've got guided note-taking to reduce, errors. We are able to track patients, whether they are stable, improving, or deteriorating. But because we've got clinicians who also go to patients' homes, we want them to be able to capture things like, wounds and see how they progress over time. And then lastly, we've managed to organize our clinical notes in ways that are easily retrievable, unlike your traditional hospitals, again, where sometimes you have to wait hours for them to bring out their folder. My pride and joy is being able to do a 12-lead ECG in the comfort of patients' homes. When I graduated from med school many years ago, you could only do this in a doctor's room or if you've been admitted in a hospital. Today, you're able to do it in real time in a patient's home with a diagnosis, transmit that to the treating provider, and prepare theater if you need to operate for those patients. We're doing that in South Africa today. Beyond that, our doctors are able to consult with their patients in real time, all the meanwhile while the vital signs are in front of them. And then all of this data comes together through a command center that we run, and it's a 24-hour command center that's run by doctors and clinical associates and nurses, and it's based here in Bryanston, and we provide the service to all our national teams. And so at Quro Medical, we've really built an ecosystem that combines both wearables and an app and tech ecosystem, combining that with Quro Medical Analytics, a health professional dashboard, and this technology platform can only be surpassed by our excellent clinical support. And so the technology and the solution, the concept might sound great. What I'm telling you is what we're doing today. We've done over 200,000 admission days to date. We look after patients over So we've got over 30 different types of clinical conditions. We've got, a very high patient satisfaction score. We manage at the moment about 12,000 admission days per month, and we've managed to reduce the length of stay by 60% significantly. Now, the other thing I do want to highlight is that before we existed, there was no reimbursement for the solution. Today, we are proud to be fully reimbursed by the medical schemes in South Africa by over 90% of all medical schemes. And one of our big players who's sitting here today, I saw there's a GEMS, who's the largest closed government employee medical scheme, is one of our clients that offers this to its members. But beyond our ability to create a reimbursement environment, let me show you very quickly the rands and cents. If you compare a traditional hospital stay to a hospital at home stay, you could treat 3 patients for every 1 patient who's being admitted into a hospital. And so the cost savings are huge. Beyond that, the cost savings associated with with additional costs such as radiology, pathology, and provider costs, you can see that this is a game changer for our healthcare system as a whole. And so not only have we been able to reduce the cost of care, we've managed to reduce the length of stay, and most importantly, patients do love what we do. And I'll hand over to Joost, who will tell you a little bit more about that.
Thank you so much, Vianney. This is pretty amazing. I still can't believe we actually built this over the years. Our patients and family, right? That's the people who we do it for. So if you look at what are our patients saying, they loved our services. It's way better than hospital care. The staff is friendly, and they actually get useful feedback, something that they can do with. They love the program that we offer, and they're just very grateful and give us many blessings. And one thing that's always quite surprising to me is that it's very obvious that it's so nice for a patient to be in home instead of the hospital. But think about family members. Think about those visiting hours between 7 and 8, where you have to travel far to a hospital, have to spend money on transport, and everybody's visiting at the same time. It's obviously so great if you can be with your family members, you can pray together, you can eat the food that you like. It's just a really nice place to be. All this has been made possible by a very capable leadership team. You've already met Vianney, the CEO, and me. I'm the CTO. With us not today is Ms. Siko Pali. She's a lawyer for her sins. She usually travels with Vianney in pairs, but she's our co-founder and chief operating officer. Then we have Dr. Cyril Nkambinde, who is a family physician trained at UKZN, and he's our chief medical officer. So we have a very experienced and capable leadership team driving this company forward. Healthcare is moving to the home. So it's obvious that we are saying that, but we're not the only ones. Many of the big consultancy groups have published articles about how they see the whole healthcare market shifting, right? And both Deloitte and McKinsey have published articles around how this is a global phenomenon. So it's not only happening in South Africa, this is happening across the globe, right? So if you look at the UK, for instance, the NHS, where the government is sort of operating the hospitals, they currently have virtual wards where they take care of people at home instead of the hospital. In the USA, many of the big, well-established, very rich healthcare providers are moving their care facilities to the home. In Australia, the government is looking at this. How can they do this at the national level? How can they do this at a local or regional level? But also in India, similar to us, not one of the wealthiest countries, massive population. More than 5 million people have already been treated at home. So this is a global phenomenon that's happening. One of the important things is that we improve access to these patients. So I saw a lot of Gen Zs today. On the left, that's a camera. I know you guys don't really have experience with them, but we're bringing them back. You can see Vianney there with a camera. But it's not just a camera to make pictures and selfies. It's actually a fully fledged X-ray machine that is completely mobile, and you can take it into any environment. This X-ray machine makes pictures just as good of a quality as in hospital. The radiation output of this machine is less than the TV that you have, and it only weighs 3 kilograms. And it has full AI functionality enabled in the platform. Then on the left, you can see an ultrasound probe, right? So you can connect this probe directly to an iPad or an iPhone, and you can literally scan any organ in the body. And our team has done this in the office like many times, where they actually have this probe and they're sort of scanning themselves, which is really, really cool. Yet again, a good example of how do we bring these large, bulky devices, how do we slim them down, how do we bring them to your home? Brianni was also mentioning pathology, right? So we can go into your home and withdraw your bloods. We then drop off the blood sample at any path lab, so be it Lancet, be it MPath. And because we have close relationships with them and we've done direct integrations with them, they will treat that blood sample with the same urgency and priority as they would in a hospital. And the results come directly on our platform. I'm sure you've heard AI many times today, so let me not be different from any other speaker. How are we using AI right now? Right, so there's this massive hype and this massive drive around AI. And we are using it a lot in our coding, right? To write code, to review code, to make us work faster and more efficient. And there are a lot of like AI healthcare services out there. Like you can buy so many things. The reason is that we're talking about this is that we are a little bit different. We are very cautious about using AI on our patients. The reason for that is that this technology is new, but it's not 100% accurate. And different from all the technology service providers, we don't only provide the technology, we provide the healthcare service. We know these patients, we know their family members. We cannot let AI make any mistakes and have a negative clinical outcome on our patients. Therefore, we are at the moment very, very careful in using AI. However, we do think that the future is very, very bright. The beautiful thing about healthcare, I find, is that everything has been studied and researched, right? People like Brianni have spent decades of their life understanding the human body. And we understand the human body very well. We understand medicine very well in general. So there's a lot of data available, right, to train these AI models. On top of that, we generate a lot of data of our patients. So the things that we can do in the future with AI is going to be truly remarkable, we believe. We could have a virtual patient, right? Where you create a virtual patient, which is almost an exact copy of the existing patient, and you can start using AI to model certain things. What if I give it this medicine, right? What if we treat it this way? What would the outcome be? And that is very similar to how you have a software platform where you have a test environment or a QA environment. We will in the future also have very, very detailed and very accurate early detection systems, right? We will know when you get a flu before you actually get a flu. We will know when your fever increases before it actually happens. So the future of AI combined with healthcare is really, really amazing and very interesting. To do all these things, we need a lot of data. And the good news there is that your body produces a whole lot of data, right? So if you look at the amount of vital signs that we capture for one patient in just 1 week, it's 151,000 heart rate data points. 75.6 million ECG data points, 756,000 respiratory rates, the activity tags, the temperature readings, the list can be made even longer. But what I'm trying to say is that your body generates a lot of data. Now we, as Quro Medical, need to process all this data in real time because this data is super critical for the care of patients. So we better make sure that we have a very reliable system to do that. Our medical wearables connect to a patch or connect to a relay device that is Bluetooth, and we stream this data into AWS IoT Core, which is the IoT solution of AWS. IoT Core is able to process or stream significant amount of data because all those data points that you saw now, you need to multiply by thousands of patients across the country, streaming real time into the cloud. You better make sure your technology works well. Because if that stops, the patient doesn't stop breathing or their heart doesn't stop beating. So we get all this data into IoT Core. From there, we have different queues and mechanisms to sort of split out and process this data. We use SQS and AWS SNS. And from there, you ideally want to store this data, right? So we're talking about terabytes and terabytes of records. And you want to be able to get these vital signs very quickly if a doctor is looking at a patient. So for that, we're using DynamoDB. And the beautiful thing is about DynamoDB is that you can partition the data very well. So it's extremely fast, both on reading and writing. So some amazing technologies there. If you then start to look at our healthcare systems today, right? I went to a new dentist yesterday, and guess what? I got the yellow form, I got a pencil, and I could fill it out. So I'm obviously not here to say we need to move away from paper. We already know that, right? If you look on the left, that is a sheet that a nurse uses to capture vital signs in the hospital. So if you're in the hospital, she comes with a machine or a trolley, does the readings, and scribbles some stuff down. That is the lives that we live in 2025. But what is even more important, besides the moving away from paper to a digital system, maybe more important than that, is actually treating people holistically. Healthcare is not something that happens in a silo, right? Healthcare is very complex. Patients have many doctors. You had previous hospital admissions. You had previous pathology results. You've been taking medications. You might have chronic conditions, right? And if you want to really get great clinical outcomes, you need to make sure that all this data is available so that at the point of making a decision or diagnosis, you have a full picture. The problem here is that at the moment, we don't have a full picture because all these systems and all these beautiful healthcare systems that the doctors use, that the hospital use, don't talk to each other. Right? So we can't exchange healthcare data about our patients with other systems. It's just technically not really possible. And the good thing is that there's a partial solve for that. So it's called FHIR. So what is FHIR? FHIR is a healthcare standard. It stands for Fast Healthcare Interoperability Resources. It is basically a schema that is defined. It has defined on an international standard. And this is used across the globe. It basically talks about what does a patient looks like, right? Is the patient, does it have a surname or last name? Is it date of birth or birthday, right? So it defines all these fields and attributes, not only for patients, but also for practitioners, for admissions, for clinical notes. For all these different resources, it's very much defined what these things look like. Now, if your patient looks exactly the same as my patient, I can send you my patient data, and your system will be able to swallow that and use that immediately without having any difficulty or transformations of the data set. Now, that is very cool and all, but where am I going to store all this patient data, right? I need it to be fast. I need it to be super secure. I need it to be compliant with local and international regulations. And this is basically where AWS HealthLake comes into play, right? A lot of us know how complicated databases can be and what a nightmare that can be to manage and make sure that databases is fast. The beauty about AWS HealthLake is it takes care of all of that for you. It is basically an API. It's a service you can talk to that understands the FHIR schema. So you give it FHIR data, and it's able to store that. The beauty is that we, in our platform on Insight, we have thousands of patients. I think we're getting pretty close to 1 million of clinical notes. And we have 0 database. There's no database I have to manage. It's just a service I talk to that is compliant, super fast, super scalable. Yeah, so that is a little bit about the magic technology behind Quro Medical Insight. Lastly, we have a few jobs available for the engineers here in the room. If you want to do something different from building yet another insurance or fintech platform and you want to do something meaningful with your career, you want to work with highly skilled and awesome people, have a look on our website and please apply. We'll see you again. Jabu? Ah, there you are.
you, gentlemen, for the great presentation you've made. I would like to ask, you mentioned that you're using FAIR as the standard for data that you're using. Are you transferring data from the old service provider to your system? And if the patient was to move back to a brick and mortar hospital, do you also transfer that information? Or you're just sharing access without transferring the actual file between centers?
That's a great question. You're asking, like, how do we transfer data from one healthcare provider to another, right? Yes, so obviously you would have to build integrations to make sure that systems talk to each other, right? The difficulty with integrations, if I have a certain schema or certain standard way of working, and party B has a completely different thing. There's a lot of translation, a lot of mapping, a lot of transforming these data objects. That's obviously where data gets lost. So the idea of FAIR is that you have the same standard. So once you do an integration with each other, the data is exactly the same. So you can share this data very easily.
In our world, the reality is that there are a lot of legacy systems. So a lot of these are old hospital groups. Most of them are not even digitized. And so even with our integrations with the different laboratory partners, a lot of that work we've had to build ourselves from scratch in partnership with them, right? And so whenever there's a patient that needs to be referred, some doctors already have access, so they can log on to our platform and they can see those results. Some information from an access perspective is also transferred and given to that patient. Alternatively, a summary of care is given to that patient so that they're able to have access so that their treating providers got access to that data. Recently, we've entered into an amazing partnership with a massive hospital group, and that's going to be announced later on in the year. There again, because of their readiness from a digitization perspective, it'll be a seamless integration, which basically means that their doctors will easily be able to access information about their specific patient who've been in our care and vice versa.
Great. Thank you for the great presentation. I think my question is around, do you guys do real-time monitoring? For example, let's say I'm one of your users, right? And you continuously monitor my health activities and all of that, and you determine when I'm about to get sick before it actually happens. Is it something that you currently do?
Yes, we do. Your question is, do we do real-time monitoring? Yes, I'll give you a very simple example. One of our patients, and we've had a few of these patients, we picked up some changes on the actual ECG that suggested that they were probably going to have a heart attack. What we then did was to dispatch our clinical teams, went to the patient's home. They did that 12-lead ECG. We saw further changes across different leads. We took some bloods, because normally what the heart does is that it leaks certain enzymes into the blood circulation when it's leaking. I always say it's crying. We picked that up. We then facilitated a call with the treating cardiologist, and normally time is heart muscle. So we were able to get that patient into hospital timelessly. The cath lab was ready. The patient went in, had their procedure, and they were out in no time. And that's the value of continuous monitoring.
Afternoon.
I'm going to ask you guys just to speak a bit louder because we can't hear you.
We don't have headphones.
We don't have headsets. If that's okay.
I'll try. I think whether it's two questions or one.
We can't hear you. You have to talk a bit louder.
Okay.
Perhaps
Can you hear me now?
Maybe have one or two of these so that we can hear. Thank you. Thank you so much. Okay. Okay. Now we can hear you.
Oh, okay. What sort of engineers do you guys use? Do you utilize industrial engineers?
We don't have any industrial engineers at the moment. We have mainly software engineers, data engineers, analytical people, reporting, all that good stuff, but nothing industrial at the moment.
Okay, thanks.
So a lot of the knowledge and the training we believe is transferable. We know how to create greatness from people who come from different backgrounds. And so we don't care about what your background is. If you're open to learning and coaching and we can work with that, we're happy to work with that. Jos does a lot of miracle work. We've got guys who come from very different backgrounds. So if you're an industrial engineer and you're open to be coached and you're willing to learn and you want to work on very interesting problems, please do talk to us.
Hi. I don't know if I'm going to be able to articulate the question as well as I think I will. I wanted to ask, in regards to mental health and the changing world there is now, how does I guess this type of system predicts, number one, these types of occurrences happening. I'm 25, but how would it know if I'm going to be depressed later on? If maybe that's, obviously this is an uneducated question. Number two, people who are also genetically prone towards maybe psychiatric diseases or illnesses or challenges. I'm trying to be as correct as possible. How does the AI work, and also how does the service in relation to the AI work, if that makes sense?
Yeah. I mean, great question. The reality is that there's a lot that we don't know from a mental health perspective, just even in understanding existing diagnoses. So the opportunities there are like vast, right? I always say to my guys in the organization, what a difference a year can make. Many years ago, if you were diagnosed with chronic kidney disease, it was a death sentence. Today, we've got dialysis, right? Before that, we had patients who had, problems with their hearts. And many years later, Christian Barnard came through, and now we can transplant hearts. What a different years can make. So a lot of the things that we don't understand today are going to be uncovered. I mean, just the idea that you can provide hospital-level care in a patient's home was not a reality 7 years ago, right? And this becomes a game changer. And so the answer to your question is that there's a lot that is unknown in the mental health space, but the opportunity to do something about it is vast. All we need is time.
Hello. I just wanted to ask regarding the IoT devices.
Yes.
Yeah. What kinds of specific IoT devices do you use? Most of the ones I've been in contact with are usually like Bluetooth kind of stuff. So I'm assuming some of the ones you just have internet capabilities and stuff like that. Is there like a specific kind you guys use?
Yes. So all our medical devices are Bluetooth enabled, right? So from there on, you can use anything as a relay device, right? At the moment, we use quite low-end Samsung phones that are completely locked down. The reason for that, it was easy to develop against. It was easy for us to build an app that connects to IoT Core, and they're readily available on the market. But you can build any relay device that you might like, depending on the setting that you're in. I think one thing that was very important for us to give something to our patients that they can wear around or wear across on their body, but also make sure that it's something they don't have to think about. Right? It has a long battery life, especially because you don't use the device. It's just with you or near you. But also we provide the data, for instance, right? So the whole kit comes together. When a nurse comes and onboards you, and make sure that everything is working. And it also gives anybody in the country opportunity to use this service. You don't have to buy data and make sure that you're topped up, et cetera, et cetera.
Jabu, I believe we're out of time. And there were some hands over there. Happy to speak to the guys.
Correct.
Afterwards.
Maybe let's just take last two questions. Clearly, Quro Medical, very popular. I've never seen a truck with so many questions. Just last two.
Jabu, there's a hand over there, right there at the back. That poor man has been holding his hand for the entirety of the Q&A.
Good afternoon. Beautiful presentation. And I've got a question. You mentioned that patients are able to get instruments, medical instruments at their homes, like, for example, the X-ray that you mentioned. And through that, you can get the data and know when something is going to happen. In South Africa, there are times whereby you're not informed that there's load shedding going to happen. It's just a random power outage. How exactly, if a person is unable to connect to the internet, how are you guys going to get the data in real time? Thus, I know, sending through a medical team to come and aid the person.
Sure. What's your name?
Seth.
Seth, thank you so much for that question.
No problem.
I quite like, firstly, I just want to make it clear that you weren't planted. So I didn't ask you, I didn't pay you to ask that question. But it's an important one, right? So the first response is that we've been around for the past 7-8 years. We are currently operating in the South African environment. And the joy about building technology in a constrained environment is that you get to solve for those. The first thing is that we actually partnered with MTN. And so within our partnership with MTN, not only are we able to get access to specific data, we also prioritized in many ways, which I'm happy to speak about separately. We've got a relay device, which is dual SIM card enabled. And so whenever there's an environment where when there's there's poor connectivity or whatever the case may be, it then shuffles between the two different service providers, and then it captures the data that it transmits the data that is needed. The other thing that is important is that on the hardware themselves, so we've got different hardware. We are wearable agnostic. We've got a patch. There's an armband device. There's a bracelet we're about to introduce. They have the capability of storing data on them for up to 48 hours. And as soon as connection is reestablished, that data is transmitted. And then the last thing I want to say that in the monitoring kits, actually, what we have are backup power systems that are often needed to charge the relay device. And that's the only thing that you need to connect. And you can do up to 8 charges, which would outlast any protracted load shedding. I know this because we've had protracted load sheddings. We've looked after patients, and this hasn't been as much of a challenge as it normally would. And then the very, very last thing is that these intelligent guys have managed to build the technology in a way that enables the way in which the data gets streamed is optimized for even periods where there's limited connectivity. And so even when those towers go down, etc., you actually still have some data coming through. I hope that answers your question, unless Jos wants to add a few more.
Yeah, I think lastly is that the amount of data you're sending is extremely small, right? You're not watching Netflix. So you're literally sending a few numbers over the internet. So therefore as well, you don't need 5G data, you don't need 4G data. Like very limited bandwidth connections are actually sufficient to stream the data because it's just some numbers.
All right. Thank you for that. Absolutely last question, gentlemen. Then I can let you be on your way. But ladies and gentlemen, the gentlemen are still around. So you are more than welcome to maybe just reach out to them also. Last one, sir.
Thank you. Hi, thank you very much for your presentation. Accessibility, cost. We know that healthcare in South Africa depends on how much you have. The more money you have, the better the healthcare. Does your company, I don't know, now or in the future, have any plans to make sure that it doesn't lock out those that earn less or that don't have medical aid? Because that's a very important conversation. You don't want to start another private hospital that will also exclude those that don't have the money.
Sir, may I please have your name?
Mpho.
Mpho, thank you. I'm only asking that so that people know that I'm meeting you for the first time and that I didn't plant you in the crowd. Mpho, I am from a township in Cape Town called Khayelitsha, probably one of the largest townships that probably rivals Soweto. My mom still lives there. I am not in the business of building technology and solutions that can't reach her. She has been a beneficiary of such a solution. What we've decided to do as a company is to start out in the private sector because there's a lot of R&D that needs to take place with a solution like this. You need to test your program in a semi-controlled environment where there's reimbursement, in other words, the schemes are willing to pay, where you are able to build your technology, etc., and be able, most importantly, be able to price it right for the patients in the public sector. And that's the only reason for us. Actually, that is reason number one, that we've started in the private sector. Reason number two is that you start saying to public sector patients before you go to the private sector that you are treating patients at home. Some of them are going to perceive it as an inferior offering. But when you say GEMS and Discovery are willing to pay for it for their members, when you go to the public sector, people are willing to see it and receive it because they don't perceive it to be an inferior service. Those are really the only two reasons why we started in the public sector. But we are very clear that this is a solution that is for all South Africans. If you look at how this model has played out in other parts of the world, the NHS, it is offered in public. In Australia, it is offered in public. And we're starting to see a lot of that even in India. We're just behind, right? It's very difficult to build a solution, price it, take it to the Department of Health, and then they say, well, we can't afford it. Someone pays for healthcare, and what we're trying to do is to be able to price it right. It's one of the reasons why, by the way, we are looking after patients who we call public sector adjacent. Our patients are GEMS, Bonitas, Palmit. They live in the townships, right? And so we are able to go in and out. We are learning lessons from a safety perspective. We are learning lessons about what that looks like potentially at scale. The next tier for us is being able to do that in rural communities. And all of this, what we're trying to do is to be able to price it well so that we can scale it to those patients. And so again, I will say I'm not in the business of building a technology or solution that cannot impact people in Khayelitsha. I'm from there.
Ladies and gentlemen, we have reached the end of our session. Thank you very much for your time and attention. And thank you, Quro Medical, one more time, ladies and gentlemen.